So can you explain like what hardships you faced under this clinical research coordinator when you went to UK, US for this 15 years?
Yeah.
How hardships was there and how to overcome this, sir?
Right. So especially from my background, since beginning I was good at technology, I was good at communication, everything was there. The hardship I faced was the culture is different, right? BHMS means it is purely tradition. We are not exposed to corporate culture. We are not mostly extroverts. Maybe Gen Z has changed. When I was there, we are mostly all the doctors are introverts. There is no extrovert doctor. That has become the problem. You do your work, but you don't know, you cannot project yourself that you are doing it. That has become the problem, and that can be both advantage and disadvantage. In my clinical research career, when I entered into clinical research design, what I said, IRT,
Yes,
or
yes.
the most difficult branch in the clinical trials, when I entered, I used to go to office at 9 o'clock in the morning and come to home at 5 o'clock in the morning. From 5 to 6, 7, sleep. Again from 9 o'clock, go to office. This hard work I have done for 1.5 years, 3 years. Then I became excel in that. After 3 years, I got very good opportunities. My salary doubled, tripled. My position got 3 to 4. Normally, ladder will be first step, second step, third step. After this, I went to fourth step, fifth step, 10th step. I went. So every personality has some advantages and disadvantages. If you are introvert, you will have certain type of problems, certain type of advantages. If you are extrovert, you concentrate less on work, you concentrate more on projecting yourself. They will have different types of opportunities like people management. Depending on the personality, you will have different problems. For my personality, I am purely introvert. I cannot express. If someone gives me a topic and ask me to speak, I can speak. That is not a problem. But how to be close with manager, how to handle teams, I have learned that very hard way. Maybe after 5 to 6 years or 10 years of being in that field, I have learned these techniques. For some people this comes naturally, for some people this comes naturally, but knowledge, upgrading the knowledge, that is not possible for them. Based on their personalities, each people will have their different challenges.
So we have discussed about branches, sir. So every branch has this type of introvert, extrovert for their advantage and disadvantage, right?
Yeah, every branch, there is no exception. I don't think any branch needs purely introvert, extrovert, but there is only one branch, that is business development, where you have to speak with the client, where you are as a business developer, you have to speak with the client and get the client. For that, you should be highly extrovert. You have to have knowledge, but along with the knowledge, being an extrovert is mandatory there. Except for that branch, I don't think any other branch requires this type of skill set. But if you want to, but these are the guys who are highly paid in a corporate world. For example, a CRO hired you, clinical research organization hired you, you are getting business, you are paid very high amount, right? Of all the clinical trials, if you get business to them, you are paid high. The business development job is very highly paid job in clinical trials.